We're here at Manatee Technical College for the 5th annual Remote Area Medical Free Clinic here, offering dental, medical, and vision services. It has been a wonderful partnership with all of our community collaborators and all of the volunteers here in the area. We've seen an overwhelming demand. Over the past 4 years, we've seen right around 4,000 total patients, providing nearly $1.6 million in free care. And as you see behind me here, there's still a large turnout of people seeking additional care. So we've been working on this event for over a year now, and thankfully we have strong partners here on the ground who help us arrange some of the logistics here in Bradenton. On our end, we're talking about making sure that all the equipment is ready, making sure that we have the consumables needed, and that we have the support team ready to stand by and help. Now we've already welcomed in nearly 200 unique patients. Today we're hoping to see right around 700 or 800. Over the course of the weekend, we will exceed 1,000 unique patients having received care here at Manatee Technical College.
There's a big need in Manatee County, and as Popey said, the partnerships with the hospitals, the medical society, the dental society is most important in order to provide this critical need in the community. And funding is always an issue, and we really appreciate the efforts that you put in to bringing this to our community, because it's a challenge for not only the medical society, but it's also the challenge for the individuals that need the services that for the most part would go without them, without this wonderful addition to our community. You just have to be here to see it, to understand the need, and once you see it, you'll be part of it forever.
So we have a great team of volunteer and medical professionals that include dentists, optometrists, physicians, many of them coming from the greater Manatee area, who have given up their time and their talent, taken off from work, driven down here. So I can't say enough about how wonderful they are. We also have great participation from the local colleges and universities. We have University of Florida Dental down here with us, LECOM Dental here. We also have MTC's Dental Assisting Program. We have USF here as well, offering hygiene services. So it's been a great show of support at all levels in the community. I can't thank our volunteers enough. They are wonderful. They come out year after year and support this event. We could not do it without the hundreds of volunteers that have turned out today. We have just today, on Saturday, over 400 total volunteers giving their time and talent to their community.
We are here, Manatee Technical College is here to give back to the community. So we're about educating the community, but we're also about giving back to the community. So it is such a great event to have so many community partners, Walmart, the doctors, all the healthcare professionals. We have over 1,000 volunteers here helping. We're going to serve over 1,000 people from this community coming here for healthcare. We are so excited to be a part of this. So we actually have hundreds of glasses here. They go through all the medical exams. They come through, they get their eye exams. They come through and they pick their glasses, and then we're going to go out back and see how they make the lenses right here on site in real time while they're waiting, no charge. We're going to see over probably 500 people today for vision, which is a huge number. Walmart is a staple of our community. They are here supporting us, and it's not just the cash donation or the financial donation. They are here with many Walmart employees working here. They're wearing blue shirts just like everyone else, and they're supporting what's happening here. So my message to all businesses, we need you. We need your help. We need your support. The community needs you. And that's what makes Manatee great. Manatee County is a great community, and we're proud of everyone who's here volunteering. We want to continue this tradition year after year here in Manatee County to support our community.
When I was originally approached by Dr. Connard to team up and help coordinate the dental portion of this, I immediately jumped at it. It's been a natural part of my upbringing and everything to give back. And well, today historically we do 3 different areas. One is for cleanings. We have a section with the State College of Florida Dental Hygiene Program operating cleanings in the back portion here. We have students and dentists from the University of Florida. I think there are 28 that are along this one side here. We really appreciate their contribution. We have LECOM providing D3 students in assisting roles with the local dentists, and we have our local dentists along one row, and they primarily do extractions and fillings. And the patients are screened. We have a triage group out front that screens for what the appropriate needs they have, and so we do a lot of tooth removal and a lot of fillings to make people comfortable. And probably that's the most significant thing, that people walk in with some pain. They've been waiting all night. Some were here yesterday afternoon waiting to get in this morning. And so it's a great thing to be able to provide comfort and relief to people who are stressed and need that help. Unfortunately, it's only one time a year here in Manatee County, but to the extent that it serves a broad scope, we have people from adjacent counties that drive in, who know about RAM, who come from all over the region to get care on this particular event. RAM has historically been available all around the country, and we're fortunate to finally have one. And in Florida, we're fortunate that it's right here in Manatee County, serving Manatee, Sarasota County, City of Bradenton, and community cities. They do a fabulous job setting this up. There are over 60 chairs for dental care today, and they're brought in and set up yesterday. MTC went through a major conversion yesterday as 18-wheelers came in, offloaded the trucks. They did all the vacuum lines and power supply and electricity to function this. It's phenomenal. They have an x-ray section, they have cleaning, they have sterilization. Everything is well organized and by the book, and exceptionally, amazingly clean and sterile and nicely put together. It's really a phenomenal, long-standing project that RAM does. I congratulate the vision that they had in doing this to help all over America. As a professional, to be involved in giving back to the community, it's a 1.5 day project, but it means a significant amount to people who otherwise wouldn't get that care. So I think that there are different community efforts done for all kinds of things, and I think this is great, at least for the dental section. And there are other elements of vision and medical that are also being taken care of, vaccinations. So this is a broad-based health coverage, but certainly dental is a major portion of that and a major draw for the community to get that type of service. Well, there are a couple of different aspects. One is to be aware that it exists, certainly support people to come out and take advantage of it, if they have the capacity to help fund it. There is organizational support. Walmart has stepped forward this year to be a major contributor to help out, and other sponsors from the community. And so it's really a broad-based community effort. And so there's opportunities, if they go to ramusa.org, there are opportunities to either personally volunteer, to be part of people wearing a special t-shirt, doing just guiding people around or filling out forms. There's all kinds of things that people can contribute just with their time and support. And so that's one opportunity, but the others, if they have the opportunity out of their pocket to help out, that would be appreciated as well.
I've been with Remote Area Medical since, I'd say it's probably 15, 20 years ago. I was working with Stan Brock down in New Orleans after Katrina, and helped him there, and was a lab lead down there, and I've been a part of the organization ever since. I'm here and there. I mean, I live in Maryland, but I live in Florida in the winter months. I'm a snowbird, so we do stuff here in Florida to help in Florida as well as up in Maryland. And then if they need me for the truck at some point, I can always fly in somewhere where they have a need. Usually when we're new to a particular area, usually you have a little more, excitement, about having a pair of glasses made for them, and they're real happy, anyone that has a situation where they haven't had glasses for a while, the reactions are all different. I mean, being able to see, I mean, just being able to read something like reading the newspaper is a big deal. So I mean, it's those little things, and we can actually make it happen. Basically, the process is we have the optometrist give us an exam form which has the actual prescription for the glasses in it. And what we do is when we get a tray in the end of the truck here, at the very end, where they're at over there, and they're pulling lenses from lens boxes that actually have the actual prescriptions in them, whether it be a single vision or a bifocal lens. Then at that point, what happens is they read the lens and put dots on it. They trace the frame, they block the lens, and then it comes to these machines here that actually cut the shape of the lens into the frame. Then the final process, of course, is assembly, and then Lee here, he checks them out with a lensometer, and that's pretty much the whole basic process. We get volunteers on here to help. I basically have everyone come in here at the beginning of the morning, and we go through the whole process. And then what we do is then we'll put each person at each station where they learn how to make do their particular job, whether it be to trace a frame or whether it to be pull lenses. Some of them are people that have been with me before, but majority of them are all volunteers that just have shown up today that want to help. And I'll probably be going through the same thing tomorrow. There'll be some new people on the bus tomorrow too, do the same thing over again. It's pretty incredible that we can offer this to our patients. And if someone has a difficult prescription or something like that, we also have the facility to where we will ship them glasses with an unusual prescription or something like that in it. The other nice thing is we have had the donations are from ESTES company, which basically gives us the lenses for manufacturing, and they're a very big help to our cause as far as for lenses and frames both. Basically a new experience, something they've never done before in their life. They have an opportunity to actually learn something that they never had the opportunity to learn before. And I would say it's probably the whole volunteer part of it is probably the most rewarding part of it for them, as far as the learning how to use a piece of equipment that they've never been in front of before. I mean, you have a young person like this that has absolutely, no clue about this stuff even being out there, and then walking in and actually working on it. Yeah.
Basically, these machines will have the shape, and they cut out the lenses. I think it's really nice that someone my age can have this kind of experience to help others who need the help. It makes you feel good, and it's good to see people my age and older that are actually coming out to do this. I would have to say I would definitely encourage younger people to come out and do this. It's a new experience, and it's cool.
My girls are a great group of students. They are really caring and compassionate. They help with education. They're trying to teach people as they go along how to take care of themselves, how to help themselves to be healthier. And I think they're doing a great service for the community.
My name is Chelsea. I go to school at MTC, Manatee Technical College. I feel like this event is very helpful, and it's, I think it's a great idea. It helps a lot of the people in the community that don't have health insurance, that need help, that need medical attention. So I think this program is awesome.
My name is CASSIDY. I also go to MTC, and I'm in the practical nursing program. I think it's a great way to kind of showcase our skills and show what we've learned. I think it's a really great way for the community to come together as a whole and kind of just put together everyone's own individual benefits and what they have to give and give it to the community.
With all the programs and services at MTC, it really does offer them an experience, first-hand experience of what their workforce is going to look like when they finish with their certifications. And of course, this facility is perfect to house an event like this. So there's a great need, but there's a great opportunity for those that want to enter the workforce of coming here and getting training and entering the programs at MTC, because the work is available, the work is there, and the need is there as well. Well, as you know, there's not a one-size-fits-all. Not every child is going to leave high school and want to enter a university. We need to ensure that they get to choose their path, whether it's directly into the workforce and they're prepared right when they leave, the military, or entering a technical college or university. There's plenty of opportunities for each and every student, and it's our job to provide all of those options for them. Well, there's no doubt Manatee County has to be one of the most caring communities I've ever seen. Volunteers are willing not only to come here and help for this event, they volunteer in our schools each and every day, and without that community support, we would not be as successful as we currently are. So it certainly warms your heart to see just the outpouring to make sure that everyone has a better life here.
My name is Christina ESTES. I'm a medical student at the University of Florida here at RAM Clinic because we want to give back to the community and those who are underserved. We have women's health in the back area. We have dermatology, neurology, doing procedures in the other room over here. We have pediatrics, we have family medicine. I mean, really, you name it, we've got it. And even if we give a prescription to something, we have lists from Publix or other pharmacies that provide either free medication or at low cost. And then we also have great people working behind the scenes who are setting up follow-up care for these people to be seen afterwards. And it's not just like a one-time visit. We give them a prescription and say goodbye. We want to take care of you and make sure you're followed up with. Really interesting to see people who haven't been seen by a physician in one of the nurses here was saying her patient hadn't been seen in over 20 years by a physician. And so finally she has access, she has the ability to come here and be seen by people. So we want to give her the best care possible because who knows, maybe she won't want to see a physician for another 20 years. So this might be the one opportunity we get to help guide her and give her a good experience to hopefully be able to follow up and care for her. Well, the medical component is really interesting because you need it for certain procedures that maybe dental's doing or maybe that vision needs, because a lot of it's really intertwined. So with dental, they won't want to, pull a tooth out if your blood pressure is like skyrocketing. We need to check that. We need to kind of get that under control here. Or vision can look in someone's eyes and see that, wow, their diabetes is very uncontrolled. You can see that in the back there. And so they'll send them here and we'll give them diabetes education because we have nurses over there stationed ready to talk to them with all the information. Well, RAM is really interesting in that it keeps up with you. If you've volunteered before, they send out emails. They like, hey, this is what we're doing here and where and when and what we need as far as volunteers-wise and supplies and things like that. So they reach out themselves to people who've already done it and have been involved and seen the impact that it makes. And then as well, we have, the University of Florida specifically has I don't know what to say or call it, but it's organized in our college where Dr. Hatch is our attending who always goes every year and makes sure that he recruits the medical students to come with. And I know the dental school is very involved as well. So every year, whenever there's something nearby that the students can come to and the faculty are wanting to come to as well, we try to set that up. I just want them to take away the feeling of community and being able to give back something greater than themselves and coming together as a team and working together with all these different interprofessional teams and giving back to a community that, really deserves it and deserves to be taken care of. I think it's a great way to get involved, give back to your community, and change people's lives, really. It's amazing what you can do with just one visit with someone who might not see a physician regularly. So the impact you make is worth it.
I came down to RAM with 11 of my classmates to help provide services to people who haven't had a good access to healthcare within the past few years here at Manatee Technical College. RAM is an incredible organization, and if you ask any of the volunteers here, many of them have volunteered for years at clinics across the country. We provide a variety of services, a lot of dental services, a lot of medical visits and medications. We get glasses and eye checks for people who haven't been able to see a doctor for whatever reason in years and years. And many people walk out of here for the first time with new glasses so they can read, or medication because they haven't been able to see a doctor for however long due to insurance issues. And RAM is kind of a national organization that addresses those gaps in the health system here in the country. And so I started up in Virginia, maybe back in 2015. I was in Wise, Virginia, which is one of the big RAM clinics. I was working up there at the time, and eventually I came down to medical school in Florida. And as soon as I found out that there were RAM clinics in Pensacola, which is in the Panhandle, and down here in the Tampa area, I just had to get my fellow students on board. And it's a really exciting opportunity. We have so many medical students that want to come down here. We have to turn people away because the interest is so great, but we want to make sure we're giving the best care to the patients that we get to see. We were able this year to bring 3 of our physicians from UF. One is a pediatrician. We have an internal medicine doctor and a family medicine doctor, and there are providers here from USF. There's neurologists and dermatologists, orthopedics from the community around the area. And like I said, these people come back every year because they love to provide these services to people who can't otherwise get them. I'm still a year away from being an official doctor, but I think it's that, the state that our country's in right now is we have a lot of gaps in what people can afford and in people's access to different healthcare providers. And based off of where you live, you may be able to see a doctor, whereas if you live down the street, it may cost you a fortune to get in to see somebody. And that system is not going to be fixed for a long time. But what I think is so great about this organization is that we can help bridge those issues, and we can get people into follow-up clinics, so we can get people services at reduced costs or free often. These are things from just simple medication refills to somebody seeing a doctor for the first time in 40 years and getting an HIV screening and things that are really crucial to someone's health. The volunteers come from all over the country. So RAM is a national organization. They send people everywhere to run these clinics. And the person who's running the medical clinic is actually from Virginia. And she is down here to offer her services and make sure that the local community has all the resources that they need to follow up. And the volunteers come all across the country to these clinics. But the patients are also coming all across the country. When I was up in Virginia, I had people who drove 8 or 9 hours the day before the clinic, stayed in their cars all night, and then were first in line at 4 a.m. to get access to services because they just didn't have it at home in the Appalachian Mountains. And here we see that too. People from Alabama and Georgia are coming down to Florida. These people are all in our backyard, and they don't have the services that they deserve as a human being. So I think all the volunteers are really happy to at least address some of those issues, even though it's only a 2-day clinic. That's why the volunteers keep on coming back. This place is just filled with gratitude. The providers here are selfless and gracious. The patients are so grateful for any of the services we can provide, and surprised, for example, when we have actual certified Spanish translators to make sure that we understand what we're talking about with the patient. The atmosphere here is really an atmosphere of gratitude, and we have a huge dental clinic that's seeing hundreds of patients today. In fact, that's the mainstay here at RAM is dental services. But then we have people who are being screened for diabetes and high blood pressure, and they may not have ever heard of these conditions. And so a big role that we have is explaining them and explaining the need to follow them up and the need for treatment and healthcare so that they can live a healthy life with chronic medical conditions. There's no reason that you should not have access to insulin or not have access to medications that can help your blood pressure and give you a normal lifespan.
Hi, my name is Jessica Maxon Barrier, and I'm with United Way Suncoast, and we are here representing the families in our community to provide books and literature for our 211 and our help services. We've had great response. We've seen lots of families with kids coming up to get books for their children and to talk about how they can best read at home and use and get literacy practices at home.
My name is Heather Kester. I'm with the Suncoast Campaign for Grade-Level Reading, and with the help of the Patterson Foundation, we have organized the 26 community organizations to be here and to connect with the families that are attending RAM, the Remote Area Medical Access. We're also here with a booth set up giving away books today for children of all ages, and they're in Spanish and English.
The emphasis on grade level reading is so we can make our students more successful so that they're more likely to graduate and become great citizens of our community and stay engaged in our community. We focus on pre-K through third grade because we know we have a saying that in third grade you start reading to learn instead of learning to read. And so our focus is on providing the resources and materials so that our students are successful and have great literacy, have met great literacy standards so that they're successful in future years.
Yes, we actually have 3 agencies here giving out books. United Way Suncoast is giving out the bigger chapter books. The Suncoast campaign for grade level reading connected with them, and we made sure that we weren't doing the overlap of books. We have children's books, we have hard books that the parents can engage with the children with, and we also have the Manatee County Early Learning Coalition giving out books as well.
Manatee County is focusing on the Big Plan this year, and the Big Plan is a collaborative effort between organizations like the Patterson Foundation, Suncoast Campaign for Grade Level Reading, Manatee County government, the school district, our ELC, our Early Learning Coalition, and we are focused on getting our students reading on grade level by third grade. In the 2017-2018 school year, 74.9% of students in an identified 10 Title I schools were not reading on grade level. And one of the ways that we can help our community succeed is by making sure that our students are reading on grade level, graduating from school, and being successful in their future. We want you to get involved. This is a community effort. You can volunteer at programs like this and hand out books. You can volunteer in the schools. Just get in touch with one of our organizations. There are many ways for you to support our community.
Well, it just shows the tremendous community that we live in, that we're able to have this event in Manatee County. And I do know that it was partly the brainchild and origination of Dr. Connard. I know Glenn Gibolina was very instrumental in helping to bring this event to our county. And it just shows you the willing and giving of the volunteers and the participants here that know that there's a need, and they're willing to give of their time this weekend to provide dental and vision and medical assistance. For the 5th year, I've seen it grow each and every year, and I also see the need grow. When I came in close to 8 o'clock this morning, there's still a line outside of participants trying to enter, and I know that after the 2 days is over, there's still going to be other folks out there needing some of this assistance. So one of the things we're working on, as you know, is the Community Partnership School at Manatee Elementary, and with that clinic on site, it will provide dental and vision and medical for the students and that community. And as you can see, we're fortunate to do this once a year, but we need it really more than one time a year. We're very fortunate to have community sponsors. Tropicana also provided a lot of the resources for the juice and refreshments, because with the volunteers, we certainly have to provide, food and some other services that are needed. So even if they're not ones that are actual dentists or the opticians or the medical facility, it really is a whole orchestrated event. They set this up in just a matter of hours after school ended yesterday. It really is a well-oiled machine, and we're just very fortunate to have it here today, and we're looking forward to bringing it back again next year.
I'm really very pleased with the way things are evolving. I never cease to be amazed, because every year we start with a huge number of volunteers who come here with a skill set but have no idea what they're going to be doing to help carry out this complete medical, dental, and visual clinic. So it takes about a half hour, maybe as much as an hour and a half, that everybody learns their jobs and it gets moving smoothly. We're at that point now. We'll see between 700 and 800 people today, I feel. All of our areas are full. They're working efficiently. We're moving people through and getting a lot of nice response of gratitude from the patients for what they're getting and in the way of service and products. I would anticipate we're scheduled to probably create 400 to 450 pairs of prescription glasses for these people who are coming through. This area, before the end of the weekend, will see in excess of 400 patients. We'll probably do 80 to 100 pap smears. They'll get their vouchers for mammography. And as you look around, you can see a lot of very dedicated healthcare providers here, all the way from physicians and nurses and nurse practitioners and CNAs and lay people helping to integrate them through the clinic, as well as interpreters helping those who have any sort of communication difficulty. I would like for us, from a media standpoint, to take away the importance of what these people are doing for those who may have the privilege to serve, and then that we might come together as a community collaboratively over the next few months or years and expand this concept to where we can meet all of the needs of our underserved and indigent population. Charles, this check represents the financial contribution that the Walmart people, literally from their Naples store up to Pinellas, have contributed to help us make our program very successful this year. And they've not only done that, but they've got a lot of product that they've brought here. And something that I think that is even more important to me, the team of their very senior people in this region have literally become a part of our host committee to carry out this 5th annual expedition of our program.
I've been with the company about 25 years, and this was the first year that I've really been invited to talk about it. I have one of my peers and colleagues, his name is Mitch Ziobro. He gave me a call and said, you know, we've got this wonderful event that our pharmacist team is going to be helping at, and we thought that we really would like part of Walmart being part of this as well. So I met with the team at one of the board meetings and absolutely fell in love with the entire idea behind it, and I know the struggles of this area. So we were in it from every store. So we fully committed from not only the neighborhood markets, which I represent, but also from the super centers as well as the distribution centers. So we're very proud of this number. You know, you don't realize exactly the scope and scale of what this organization does, and it put me at intake today, and how best to welcome people like Walmart welcomes people into their stores. We're welcoming all these people that have been waiting, these patients are waiting overnight, and talking to them about whether or not they've slept or not. It's, man, we're getting more than that 51,000 we gave. I know that there's at least 10 volunteers for tomorrow. I don't know exactly the actual number because they're still filtering in, just to do tear down and help everyone pack back up so that the RAM teams don't have to do it alone. We have our pharmacy teams that are here giving free flu shots to everyone. So there's multiple numbers of pharmacy technicians as well as pharmacists here. We've got ophthalmologists and optometrists and opticians here as well, the full gamut of their vision center. And then we have our general staff, the ones that are coming here helping to cook and clean up and do setup and tear down and doing those things. So we have probably about 50 associates at least, and that doesn't include our truck drivers who brought over the product and helped us tear down and bring things in and out. So we've been all in for a while, and I will tell you, we'll be back next year as well.
Well, needless to say, the collaborative effort of a major organization like Walmart makes an effort like this exceedingly more successful. One of the things that I also wanted to mention is that Walmart is providing 400 flu shots to this program this year, and their contribution just seems to never quit. Truly nice to have such a major business partner in our community collaboratively working with us in the school district to carry this out.
Well, I'm going to say, too, that I had the privilege of working with Walmart almost a year ago in Callaway, Florida, after the hurricane. And I came away extremely impressed by the whole company and the culture and the dedication. But they helped put together a clinic in record time. It was just less than a month.
I think that all you need to do is ask. And sometimes we are not really knowledgeable of some of the organizations that are in need. You just need to reach out and make a phone call. We'll figure out the how, but you know that we'll always be in.
Being my first event, this is awesome. I will continue to do it in the future. And as we say at Walmart, spark kindness.